In this video, we listen to the chair of POTS UK and retired GP Dr Leslie Cavey talk with Dr Boon Lim about compression, which can often help to improve symptoms and prevent fainting.
Compression. So we often recommend our patients with POTS to wear compression. Why does it work and what kind of compression should they be using?
Well, as explained in some of the earlier videos, patients often pool blood in their arms, their legs, and in their abdominal cavity and pelvis. And so by compressing the outside of your body, it squeezes the blood back up to your heart and onto your brain. And there have been some studies that back this up, showing that if patients wear compression, it reduces their heart rate and it reduces their symptoms as well.
Good. I just make a point about exercise and compression. Swimming gives you free compression because when you're in the swimming pool, the water pressure all around you, plus the fact that you're horizontal in the swimming pool, can be a way in which you can tolerate exercise a bit better. So when you're looking for conditioning, you get free compression while swimming, and it may allow you to do more cardiovascular workouts. There's a lot of confusing garments, or there are so many products for compression. So do they get Lululemon hot pants? Is that enough compression, or do they need something more medical or specific for compression? What do you advise a patient?
So the ideal type of compression is 20 to 30 millimeters of mercury in compression tights. So they go all the way from your toes, and importantly, they cover your tummy as well. There have been some very recent studies coming out of Canada that have shown that if people wear socks or thigh length compression, it isn't as effective as compressing your abdomen and your pelvis. But a lot of people find that this compression is sometimes difficult to obtain. You can get them on prescription from your GP, but they're not on a lot of GP formularies per POTS, or if any. And so patients often find it quite difficult to obtain them on prescription. You can buy some of them, for example, from some pharmacies and online. But people often find that they are quite uncomfortable to wear, and they often overheat in them. And we've spoken already about overheating and how that can make your symptoms worse. So patients often find that wearing sports compression clothing is much more acceptable. And where that's possible, that should be from your ankle to waist high, and really as strong as you can tolerate. You can also get compression shorts, and although these are not as effective, if you're unable to tolerate the full length ones, then that's probably better than nothing.
So I often say to my patients, something is better than nothing, exactly as you said, and it has to be Spanx, which is the high-waisted shorts from just high chest to just below the knee. That's also going to be helpful, and it's really validating to have the Canadian study in which the splanchnic or abdominal compression is shown to give better outcomes than lower limb compression. That's quite interesting because it shifts our understanding. We've always tended to focus on wearing stockings, and patients sometimes focus on getting lower limb or above knee, lower knee, below knee or above knee compression. And that's not enough. Actually, we need to go higher than that. The other thing to say is that abdominal compression typically is easier to take off and put on, rather than the full leg compression from your toes to your waist, because it typically is in the form of a Velcro thick strap that you can buy, and it's quite a comfortable cotton thing that you can strap around, and you can make it as tight as you can bear. And so it's not like the graded compression that you wear in your legs, which is fixed and quite difficult to change. If it feels too tight the first time you put it on, it's always going to feel too tight, but it's worth trying. Do you know of any brands you would recommend? Or like if I'm a patient watching, like where do I go to? Because there's still too many things out there.
I can only tell you about feedback we get from patients, and they often talk about Skins and Juso. But there are a lot of sort of mimic brands out there that you might find are are quite a lot cheaper than that.
Okay, so skins compression is one that I also find my patients like quite a lot, and it looks good for spots. And then from a medical point of view, to get the correct grading, 20 to 30 millimeters, I'm often directing them to Bauerfeind or Sigvaris, some of the medical brands, which they can buy directly off the medical website. And that's about £85. The cheapest one I've seen is around £40 from a generic website. But yeah, if you stick to what you can tolerate, that's the most important, rather than fussing about the brand itself. There is a challenge in patients who I say go and get compression. They come and see me a year later, and there's a lot of finger pointing. The GPs don't prescribe it, or my pharmacist doesn't have it. What would you say to those group of patients?
Well, they are available to buy online. We have a page on our website on compression, and that gives you some suggestions as to where you can get them. If you are looking for the medical compression tights, then ideally you should be measuring yourself up for them. And again, there's instructions about that on the website. And also they're really difficult to get on. Some people find that their symptoms are triggered just by putting on the compression. And so there's a little bit of advice about that. You can use things like rubber gloves, for example, to get them on more easily. And one of the other barriers to GPs prescribing is that, and I know this from personal experience, they are incredibly difficult to prescribe using the computer systems that GPs have. It would sometimes take me 15 or 20 minutes to find the right size and the right type for the patients. So, and to speed that process up on the website, we've also got some instructions for the GP on how to find the right tights for you on their computer system.
In summary, you can get compression on prescription, but it can be difficult to obtain. Compression clothing can be difficult to put on and sometimes uncomfortable to wear. If you cannot tolerate it, sports clothing can be a good option from ankle to waist height. If you can't tolerate full compression, shorts can be a good option. Something is better than nothing. Find out what works for you. Visit our website for more information on compression and advice on sizing and measuring that can help speed up your GP appointment.